Hello, my name is Wendy Herron, and I'm a respiratory therapist with 22 years of experience. My goal today is to define respiratory syncytial virus and bronchiolitis to increase the public knowledge of the disease and the treatment options. So, what is RSV? RSV is a multinucleate mass of protoplasm that comes together with the neighboring cells to form a syncytial in the lower tract, hence the name respiratory syncytial virus. However, in lay terms, what that means is that it tells the body to make secretions. What is bronchiolitis? Bronchiolitis is an infection of the lower respiratory tract, usually associated with RSV. Who does RSV and bronchiolitis affect? It affects everyone. It's highly contagious. However, mostly children under the age of 5 are the ones that have the most trouble. Infants less than 3 months old are usually the ones that have to be admitted into the hospital. The reason is because the amount of secretions, their little airways aren't able to breathe around it. Also, they swallow most of those secretions, which upsets their little stomach. Respiratory syncytial virus and bronchiolitis are most often found from October through April. This season, the CDC is predicting the peak in the middle of February, so we are now on the downside. RSV can be found throughout the world. It is passed from older children to younger siblings, and outbreaks are usually found in daycares, churches, Walmart, things like that, where children are in groups together. How is it introduced? Well, human indirect and direct contact is the most, whether it's sharing a glass of water, kissing, it can even go as far as touching areas and then introducing them to yourself, and then poor hand washing. The incubation time is about 2 to 8 days. So what kind of symptoms could be expected with RSV and bronchiolitis? Rapid breathing, high heart rate, decreased oxygen level in the blood, which gives you like a blue tint, which they call cyanosis, retractions along the belly, nasal flaring and grunting, a poor appetite, and you'll mostly see their nose will have dried or loose nasal secretions. They'll have audible wheezing and maybe like a coarseness in their chest. It's usually associated with a cough and fever. It's diagnosed through nasal samples, which they aspirate from the nose. They can find bronchiolitis through blood samples, and they usually do a chest x-ray. Treatment options vary. It ranges from mild to moderate. The most thing is parent education to make sure that everyone knows how to suction the baby's nose, occasionally breathing treatments, chest physiotherapy, oral steroids, antibiotics, and oral fluids. The indications for hospitalization are usually children less than 3 months of age, or if they were born at 34 weeks, gestational age. If they have any kind of cardiopulmonary diseases, respiratory rates greater than 70, if the child's lethargic, wheezing with an oxygen level less than 92% in the blood, and atelectasis or consolidation on the chest x-ray. When you look at the inpatient services provided to the child, there's not a whole lot different, except for they may use the intravenous form of fluids, antibiotics, and steroids. In the worst case scenarios, there would be non-invasive positive airway pressure and possibly mechanical ventilation. So in closing, I would like to review that we have discussed what RSV and bronchiolitis are, how they are treated, and how they are diagnosed. I hope that you find this information useful. Thank you.